I'm finally putting up a video again. It's kind of in the summer. I was on holidays. So I haven't really been around. But there's a question that I've been wanting to address for a pretty long time. I was asked it quite a few months back, and I got another similar question in, and so I thought I would tackle that. And it has to do with beta blockers, and how basically if you're using NIRS, if you're using your Moxy, what you're going to see if someone's using beta blockers, or what happens with beta blockers in the NIRS signal. So beta blockers, just so we're clear, what beta blockers do is they reduce cardiac performance, essentially. So they stop your heart from performing too much, simply said. So they reduces heart contractibility, so your heart's beating, and heart rate. So you give it to people after they have heart attacks, to make sure they don't have another heart attack. So you don't want the heart to work too hard. And so if you think about that, if you think you're artificially limiting the performance of your heart, we get into an interesting discussion about limitations to performance. Something that we talk about a lot is that there's limiting factors in your performance, and we talk about potential cardiac factors as being limiting factors. And now taking beta blockers, you're artificially inducing this kind of limitation in someone, and especially if you were to use it on a healthy person. So what ends up that if we look at NIRS signal and we look at the basic interpretation of the data we're getting, so the supply and demand relationship, and NIRS in the muscle showing relationship between the supply side and the demand side. If you were to take beta blockers and you're artificially limiting the supply side, you would expect that you're going to have a much stronger decrease in muscle oxygen saturation, potentially further down, and a stronger decrease, and all of this happening at lower performances, because you're limiting the ability to supply oxygen, and therefore the muscle will not have enough oxygen and show itself accordingly. And what's interesting about this is that actually in 2018, so this year, a study came out by Proctel and colleagues, and they did this. So they did tests, cycling tests with patients, and measured using the Moxy also in the paper as the NIRS device. They measured muscle oxygenation, and then they gave people beta blockers, and then they did it again. It might have been the other way around too, but essentially they compared that, and that is exactly what they saw. What I just said is that you clearly see when someone's on beta blockers, because you play around with the supply and demand relationship of oxygen, which is what the Moxy reflects. So it's very nice that it shows this data. And what's great, what from a diagnostics point of view, what is the wildest thing I think about NIRS and the Moxy is that how it's very, the cost of the tool isn't that high for the new diagnostic value that it's giving you. So if you put the Moxy on and you consider the fact that yes, we can discover limitations in the supply and demand relationships, as it shows in this paper with these beta blockers, you can now do testing, and based on patterns of your muscle oxygen saturation, you are going to identify individual physiological limitations. Anyone who knows Moxy and work that I've done, or work that my dad has done, we've been talking about this for a long time. So maybe I'm being a little redundant, but I'm trying to emphasize how awesome that is. That you, with such a simple tool, you can really identify your personal limitation. Okay, and we're talking about specifically cardiac limitations now, but it's not limited to that. But just this study shows that nicely. So go look up the study, Procter and colleagues. It's a 2018 study, just released recently. Or write me and I can send you the title of the study. I don't remember it. But now you can identify. So you can ask yourself, why is my performance not higher? Or even more specifically, why is my VO2 not higher? And that often has to do with this oxygen supply and demand question, because oxidative capacity, the ability to use oxygen, is so directly linked to performance, to the ability to perform, that a limitation on one of those two things is what's going to be blocking you. That's the hurdle, and you need to figure out which one it is. And if you are training for the wrong one, then you may really not be getting maximum improvement, or you might be improving much slower. That's the same reason why it's very plausible why two people on the same training program, they get very different results, because the training program may only hit the limitation of the one person, not the other. So being able to really identify that helps with training programming, I think, in a pretty large way. And I do think it's a future way of doing some kind of diagnostic, not just where's my threshold, but more where is my limitation and how should I train based on that limitation. And if I have the same threshold as my friend, but our limitations are different, do we still train the same just because our thresholds are at the same level and at the same wattage and at the same heart rate, let's assume, if the limitations are different? And I would argue no, that you should train separately. And it's nice to get this kind of reassurance and getting these studies from other people that essentially duplicate everything that we've seen, and that we've seen anecdotally, that we talk about in theory and based on other research studies. And there's just another one with the Moxy specifically that shows that you can identify, if you artificially create limitations by using these beta blockers, that will show up in your Moxy data. And it will show up exactly the way we think it should show up if you're limiting your cardiac system. So you're limiting your oxygen supply system. I think that's all that I've got to say. So yeah, I'm pretty excited about that study. I think it's a great paper. So thank you for the people that asked me about that. We'll try to get some more videos up. Thank you. Bye-bye.